Hello everyone, I'm Nazareth. I'm a certified yoga instructor and I have a Facebook page. Some of you may follow it. It's called Yoga with Nazareth. And recently I posted some information about a workshop that I will be hosting on pelvic floor pain. And I wanted to create a series of videos to share my journey with pelvic floor pain, specifically vaginal pain, and my journey with diagnosis and treatment and healing. But before I share my story, I think it's really important that I take a moment to describe some of the terms and definitions that I'll be discussing in these videos. First up, I want to give a very brief lesson on the female anatomy. I think most of us are pretty familiar with the terms urethra and the clitoris and even the labia. The labia refers to the lips or sort of the flappy part of the skin. But I'm going to be referring to the vulva, the vestibule, and the vagina. The vulva is the actual opening that leads to the vagina. And right after the vulva is the vestibule. The vestibule is very rich in nerves and also has two different types of glands, the Bartholin's glands and the Skene's glands. Both of them are responsible for lubrication. The vestibule acts as a tunnel which leads to the vagina. So to put it in a simpler term, imagine you're sitting in your car and you're going to go through a covered bridge. As you enter the covered bridge, that would be the vulva or the opening, the sort of center of that bridge is the tunnel, which then leads to the exit or the other opening leading to the vagina. So now that we have a general understanding of the anatomy of the female genitalia, I'm going to start to describe what vulvodynia is. So vulvodynia, quite simply put, is chronic pain at the vulva, the opening of the vagina, in the absence of any kind of infection or disease. And chronic refers to pain that persists for 3 months or more. Now, if you have vulvodynia, there are two types, localized and generalized. Localized pain is when the pain only occurs at the vulva and can occur during and after pressure is applied. Localized pain is sometimes referred to as Provoked Vulvodynia, or PVD. So this means you'll experience pain at the opening when you try and insert a tampon, during sexual intercourse, at your yearly pap smears, prolonged sitting, or even tight-fitting clothing. Generalized vulvodynia is when the pain occurs spontaneously and is constant. Although there can be periods of relief, any type of pressure applied will increase the pain. So that means you can feel pain when walking or even lying down. There are many causes for vulvodynia, and before I name them, I want to be very clear that I am not a doctor and I'm not here to diagnose. I'm simply sharing information that I learned along my journey. One of the first causes is hormonal changes. This can be from oral contraceptives or medication to treat cancer and menopause. Vaginal skin disorders, irritable bowel syndrome, endometriosis, something called interstitial cystitis or painful bladder syndrome, pudendal neuralgia, which is a nerve pain, physical injury or psychological trauma. There's also something called pelvic floor dysfunction. Pelvic floor dysfunction actually refers to the muscles of the pelvic floor. And those of you that aren't familiar with the pelvic floor, both the men and women have a pelvic floor. The easiest way to describe it is envision a hammock that supports all of the internal organs. Now, pelvic floor dysfunction can kind of go one or two ways. You can be hypotonic, which refers to muscles that are weakened to the point that they cannot support the internal organs. So this would be your bladder, your uterus, and in those cases you will hear of incontinence or even fecal incontinence or a prolapsed uterus. Now, dealing with vulvodynia, you're typically on the opposite end of the spectrum, which is hypertonic. Hypertonic refers to overly tight, overly tense pelvic floor muscles. These muscles support the area around the vagina, the rectum, and they will spasm to the point that entry or penetration is not possible. This causes pain, again, at entry of a tampon, sexual intercourse, or even a gynecologic exam. So that concludes the basic anatomy and terminology that you're going to hear me reference in the upcoming videos. I hope it was understandable and easy to comprehend. In the next video, you're going to hear me talk about my diagnosis with vulvodynia, particularly pelvic floor dysfunction and vestibulitis. I'm going to share what it was like to experience the pain, how I got help, and what the treatment was like. I want to thank you for watching and for learning all about vaginas. Please be sure to follow me on Facebook, Yoga with Nazareth. Also subscribe to this channel. I'm going to post the links below, as well as the link to my workshops, which I mentioned in the beginning. I will be hosting a free workshop at the Yoga Place here in Ephrata, Pennsylvania. The free workshop will be on January 14th from 1 to 3 p.m. This is basically an intro to the 4-week yoga series that I will be teaching also at the Yoga Place, which will go into depth about vulvodynia. We're going to have a guest speaker. It's going to be awesome. So thank you again, and until next time.